Okay, let's dive into this. Today, we're going to unpack the story of a drug that pretty much became a household name during a global crisis, Remdesivir. I want you to think back to early 2020. You remember that chaos, that uncertainty, right? The whole world was just desperately searching for a solution, for any sign of progress. And right in the middle of all that, one drug's name started to pop up, offering this tiny glimmer of hope. That name, Remdesivir, was absolutely everywhere. But its journey from a scientist's lab to a patient's bedside, well, it was way more complex, and honestly, a lot more controversial and scientifically fascinating than most of us ever knew.
So, before we get into its wild history, we really need to understand the brilliant science behind how it works. Because it doesn't just fight a virus, it's much cleverer than that. It actually sabotages the virus's most basic mission, making more copies of itself.
First thing to know, Remdesivir is what's called a prodrug. Think of it kind of like a secret agent in disguise. When it goes into your body, it's totally inactive. It's only once our own cells start processing it that it gets activated and is finally ready for its mission. Now, here is where the really cool trick comes in. Once Remdesivir is activated, it basically becomes an imposter. It's designed to look exactly like a crucial building block called ATP that the virus needs to build copies of its genetic code. And as you can see, the virus just can't tell the difference. It's completely fooled. And this breaks down that three-step sabotage perfectly. First, the virus's little copy machine, this enzyme, it mistakenly grabs the Remdesivir imposter. Then it tries to slot that fake piece right into the new viral chain. But as soon as it's in, it's like a faulty part. It just jams the entire assembly line, stopping the chain from getting any longer and grinding viral replication to a complete halt. But here's the crazy part. This whole mission wasn't Remdesivir's first rodeo. Not even close. The drug was kind of an accidental hero. Its story actually began way before the pandemic as a drug that was looking for a disease it could finally beat. Just look at this winding path. It started out in the 2010s being tested for hepatitis C, but nope, not effective enough. Then it was repurposed for the Ebola outbreak, but again, other treatments just worked better. The really crucial step, though, was the lab work done before 2020, which showed it had some promise against other coronaviruses, like SARS and MERS. And that's what put it right at the top of the list when this new coronavirus showed up. So with all that potential and this really unique backstory, what did Remdesivir actually do for patients who were sick with COVID-19? What was its real impact out there in the real world? Well, it was never a drug for everybody. It was really focused on two specific groups where timing was everything: patients who were already in the hospital and outpatients who weren't hospitalized yet but were at a high risk of getting seriously ill. The whole key was to hit the virus while it was still copying itself like crazy. And here's the most important takeaway. Remdesivir was not a cure. Let's be really clear about that. It didn't make the virus just disappear. But for a lot of hospitalized patients, it did something incredibly valuable. It helped them recover faster. It cut down their time in the hospital by a few days. And in the middle of a global crisis, that is a huge deal.
But of course, the story doesn't end there. The drug came with its own set of challenges, and its rollout was surrounded by some really heated debates about its effectiveness, its safety, and, its price tag.
So like any powerful medicine, it had risks. You had the common stuff like nausea, but the bigger concern, the one doctors really had to keep an eye on, was its potential to irritate the liver. That meant patients needed close monitoring. And then there was the cost. This stuff was very, very expensive. And that immediately sparked some really serious and difficult questions all over the world about who could actually get it. Was access going to be fair and equitable? Which brings us to the biggest point of controversy. The one you probably remember hearing about on the news. Why couldn't scientists just agree on how well it actually worked? The messaging seemed all over the place. Well, the reason for all the debate was basically conflicting data from two huge studies. An American-led trial called ACTT1 looked at recovery time and found, Remdesivir helped people get out of the hospital faster. But then a massive global trial from the World Health Organization called the Solidarity Trial looked at mortality and found it didn't really have an effect on saving lives. So you have two major studies with different goals reaching different conclusions. And that's what really fueled the worldwide debate. So after all of that, the hope, the clever science, the intense debate, what's the final verdict on Remdesivir? How should we really think about its role in the pandemic? I think the best way to sum it up is that remdesivir was a useful but definitely not game-changing tool. It was an important early weapon to have in the arsenal against COVID-19, but it was never that silver bullet cure everyone was so desperately hoping for. Maybe its greatest legacy isn't what the drug did, but what its story taught us. Its entire journey was this critical, real-world lesson in drug repurposing, and it perfectly captured that incredibly tough balancing act between urgent hope and hard scientific evidence, right in the middle of a crisis. And that leaves us with one final, really big thought. The story of remdesivir isn't just about one drug. It's a case study for the future. It forces us all to ask, the next time we're facing a global health emergency, how do we get better at balancing that desperate need for speed with the absolute demand for certainty?